excited from a personal point of view about the opportunities the NDIS is going to offer us as a family and my son Nick as a service user, as a consumer of services. He's been very happy in his day program. That was he started there 10 years ago, and that's his set of friends, and his girlfriend is there, and so that's a very happy place for him. And there are some parts of his week that work very well for him, and there are some parts that work less well for him. And we're lucky that our service is showing increasingly a focus on the individual person. But it's still a day program. It still runs from 9 to 3, and he's an active young man of 29, and he would like to have a more exciting life, I think, at times. He loves live shows. One of the most important things in Nick's life is to have something to look forward to. And the kinds of things that he loves and to look forward to are holidays, particularly the Gold Coast, or live shows like The Lion King or Oliver or Phantom of the Opera. He just adores those. And so I'd love to have a way that wasn't reliant on me. I provide those things for him now. It's difficult within the service system framework to have anybody else take kind of responsibility for those things. So I provide those things for him now. I'd love a sense of somebody looking out for Nick and really focusing on him as an individual in a way that was more generous, more focused on his needs, and not as constrained by staffing ratios and staffing shifts. Yes, so more flexibility for him, more attention to his needs. I guess he has an intellectual disability and doesn't use speech to communicate. So one of the very important things for me is to have staff who know him, who get to know him and get to like him and enjoy being with him. In the changing staffing structure, particularly within his accommodation service, it's been difficult over the years to have that sense of people getting to know him well, and people therefore have not understood his communications sometimes. And like any of us, if we're not understood over a period of time, we start to make our point a little bit more loudly, and a little bit of table thumping and foot stamping goes on, and sometimes the reasons for that aren't fully understood by staff who don't know him. So I'd like a sense of an agency or a group of staff, a circle of supportive staff around Nick, where there's a sense of continuity, a sense of commitment to him as an individual, and a sense of responsibility for meeting his needs in a more holistic way than happens at the moment. The big fear I have, as many parents have, is what's going to happen when I die, who's going to be there for Nick, and who's going to be looking out for Nick when I die. And Nick fortunately has a sister who will do her best to look out for him, but that's a lot of responsibility for one person, and so I'd like a sense of, I don't know what the shape of this is going to be, I don't know how this is going to look, but I would like a sense of the service system somewhere having a way of looking out for Nick over a period of time.